Welcome, everyone. Sorry we got started a couple minutes late. We've done this a million times, but we're having a few new technical issues come up. So we'll be starting in just a minute. Again, I apologize for the late start. This webinar is Virtual Health Literacy Outreach from IHA, and we have our speaker, Jessica Daly, who will get started in a minute. We're just going to give people another minute or two to get let into the room. And I think we're getting close. So I'm gonna get started. Hello, everyone. My name is Julie McKinney. I'm the moderator of the Health Literacy Discussion List and work with IHA. And I'm really excited to introduce Jessica Daly, consumer health librarian from Orlando, Florida. She's going to talk to us today about virtual health literacy outreach, something that we're all trying to do more of these days. So we're really excited. Just a very few housekeeping things to get done quickly. Jessica, if you could go to the next slide. Yeah, so you can all connect to audio. You'll be muted during the presentation. Feel free to comment or introduce yourself or shout out in the chat. If you have questions, though, if you could put them in the Q&A box, that would be helpful, because then we will feed them to Jessica after. At the end, she will take questions. So questions in the Q&A box. Feel free to use the chat. If you have any technical difficulties, the number there is support@healthliteracysolutions.org for immediate help. And just so you know, the webinar will be recorded and posted in the Health Literacy Solutions Center. Okay, so you will have the recording, you will have the slides, and you can see all of that pretty soon on the site. So if you are going for CE credits after the webinar, you'll get an email with an evaluation. So if you do the evaluation, submit it, and then you will get an email with instructions for your CE credits. So I think that's everything. And with that, just would like to give a warm welcome to Jessica Daly, and she will tell you a bit more about where she works and where she's from, and then we'll talk to us about virtual health literacy outreach. Thanks, Jessica.
All right, thank you so much, Julie. So a little change has happened professionally in the past couple weeks. I was the consumer health librarian for Orlando Health in Orlando, Florida. And with that role, I worked primarily with patients and family caregivers and also community members all throughout Central Florida and sometimes beyond when we became virtual, just helping them find the health information they need most and really trying to help increase those people's health literacy so that inevitably is going to improve their health. So within the past month, I'm still in Orlando, Florida. I don't know that I'll ever leave. I love it. But I was approached about working with Advent Health University. And I had worked with Liberty University in the past and just really missed the world of academics. But at the same time, I didn't want to give up the 5 years of experience I had as a hospital and medical research librarian either. So this was just the best of both worlds. And what's even better is that Advent Health University is encouraging me to continue my work with health literacy on different platforms, present like with you today. They see the importance and they want me to continue that work. So that was really, the icing on the cake for me in taking this job. So that is what I do here in Orlando, Florida. But today we're going to talk about something that is a passion of mine, and that is health literacy. And I want to just share how I turned an in-person library and health literacy outreach program into a virtual one due to the events of the past 2 years and COVID-19. So I'd like you to know ahead of time what's coming your way and what to expect. So first, of course, we're going to address low patient health literacy. That is a real concern for not only those of us here in Central Florida, but across our globe, and especially in the United States. We're going to talk about the story of how we were forced to go virtual. We're going to connect to the community. How did I do that? What steps did I take to make that happen? And then improving health literacy. Once I connected with these community leaders and organizations, how did we know that we helped? How did we improve their health literacy? And then with that is going to be our outcomes and our data today. So I hope you can take some things from my experiences and apply them to wherever you are in any organization. It doesn't have to be medical. Any organization or company or business can help to increase their customer or their employee health literacy. So let's start by really talking about what is health literacy. And so we go to the U.S. Department of Human Services, their definition, and there's two separate areas. And so the first area that we see is personal health literacy. And that's the degree to which individuals have the ability to find, understand, and then use this information. Well, let me tell you why we need this information. If you don't already know, we need it in order to make these decisions. There are so many decisions we have to make as patients. And so I want people to not only know where to find the information, but be able to understand it. And so here are some things that came into play for me, especially here in Central Florida. Number one, we are a melting pot of cultures and ethnic backgrounds and languages. So the first thing I realized at our hospital was that we were not serving everyone depending on not only their education level, but their language, their native language, let me say. So I really worked with a lot of nurses and physicians to offer them, as well as their patients, information written or even video information or audio information in multiple languages. And so we can't just assume that all of our patients' native language is English. And what I found also was that over 90% of what we give out in the United States in form of written health information is often in English only. And so, we do see a lot of English/Spanish, but then here in Orlando, I come in contact with patients that are Vietnamese, Chinese, Portuguese. I come in contact with French. And so all these different languages come into our communities, and they need health care, and they need and deserve to have this health care in a language that they can understand. The other thing is sometimes disabilities. So I've worked with a lot of patients that are blind. I've worked with deaf patients. And so it's very important for us to make sure we have resources in order to educate patients, no matter their learning styles or their health limitations or physical limitations. And so what I want, my goal is for patients to be an active participant in the decisions that are made about their health. They need to be able to look at information and make those decisions for themselves. And then we see organizational health literacy. And this is the degree to which organizations help individuals find, understand, and use information. So, it really is up to an organization to make sure health literacy is a priority within their business or within their organization's community. So I'm a little different. I start out by letting you know exactly where the information that I'm going to share with you today comes from. We are taking a look at Healthy People 2030. This happens every 10 years in the United States. And this is a federal plan that really outlines what we hope to see in our healthcare system at the end of 2030. And there is a huge push for health literacy, and there are health literacy objectives found there. We also are going to the National Institutes of Health. because I don't want to pull any information for the community or even you today that you don't have free and open access to. And then there's also the Institute of Medicine of the National Academies. We're going to just glance, and I pulled some things from the 10 attributes of health literate healthcare organizations. And then the last one is the CDC, or the Centers for Disease Control. They have a health literacy action plan. And if you're not familiar with it or haven't visited it or worked with it, I really encourage you to do so. Well, we can't start talking about low health literacy or low health understanding without taking a look at 5 key social determinants of health. And this comes from Healthy People 2030. So these are the 5 things that may get in the way of someone understanding their health. Number 1 is economic stability. So your economic status is directly related to your understanding or your availability to resources. Education is really a factor when it comes to how well we can look things up on the internet or how confident we are to have conversations with our healthcare team. And then social and community context. So, you may find patients that come from a social or community background where you don't need to go to the doctor. That's the message. Or, we can't afford to go to the doctor, or there's no need. We only go if we go to the emergency room. So a lot of these things are passed down generational, and it's the attitudes and the outlooks that people have been given as they have grown up. And then health and healthcare, that really is a determinant for a lot of people. Maybe someone is born with a condition or a disease, or maybe there is limited access to healthcare due to not having insurance, things like that. So all of those things are determinants. And then it actually matters what neighborhood and built environment people come from. Let me just say, even here in Orlando, I love when people see me and they say, hey, my cousin is from Orlando. Do you know them? And I think, oh my gosh, you don't know that much about Orlando, because Orlando pretty much covers the entire central part of the state of Florida. There are people within the same Orlando address that are an hour away from one another. So I try to explain to people that the hub is our downtown, and then out from that hub, kind of the spokes, are tons of smaller neighborhoods and communities. And they all have their own feel, their own vibe, their own restaurants, their own shopping. And so those things do matter when you're talking about determinants of health. So what factors impact health literacy? What are the things that we see come into play when we see patients with low health literacy? Well, first, it's the receipt of appropriate written health communication materials. So for instance, for years when I worked with Orlando Health, when patients were discharged, the only language that could be printed out and handed to them to take home was in English. So that was not okay. And so thankfully that has been changed. We now have software that allows us to print that out in a variety of languages. But at the same time, we need to make sure that we've had conversations with patients to find out how they learn best. You don't have to necessarily ask someone, can you read? That could be very embarrassing or hurt their self-esteem, but you can easily say, hey, if I were to give you some materials, would you rather have it written? Would you like to watch a video? Would you like to listen to a podcast? And so that just keeps it open for them to tell you how they would best like to receive that health information. And then there's the ability to accurately interpret written health related information. Here's the story I tell when it comes to this piece of the puzzle. I used to teach 5th grade. Did that for years and loved it, was a classroom teacher. So every year as their English teacher, I had to find out what their comprehension level was. Well, here's what we did. We sat at a table and we gave them a paragraph. Well, the first thing we tested was something called fluency. And that is just how well they can read, the flow of it, how many words they mispronounce, can't say. So I had students who would get 100% fluency. But then when I would begin to ask questions about that paragraph, they couldn't answer a single question. So this is what happens often to our patients. They can read the information, but they don't know what it means. And often they're embarrassed to ask anyone. Communication with providers is huge. Let me just say that, I pull a little personal into this. My husband is a cardiac patient. He has something called congestive cardiomyopathy, which is unexplained or viral heart failure. We've been dealing with this on this journey for 15 years. And so we really appreciate and value communication with providers. So this morning, we had a visit with his cardiologist, and his PA sat and talked with us for over 20 minutes. Let me just say that matters. And that is so valuable to us as a patient and me as his caregiver. So communication with providers is so huge. And I even do classes on how people can prepare for healthcare visits and get the most out of it. And then also we see when patients receive written health communication materials that don't match their reading level or their native language, and we mentioned that earlier, that is a factor that impacts that. And they're not going to be able to understand not only what's happened, but how to maneuver and what to do with self-care at home. So the CDC put together this visual. I love it. I use it all the time. It shows the risks of low health literacy. So these are patients that have a low understanding of their personal health. And here are the things we see, which is very frightening. And I want to try and deter any of these from happening. Number one, they're more likely to visit the emergency room. And when we say that, it's multiple visits a year and often unneeded visits because they didn't understand how they should feel or the side effects of a medication or whether or not this merited calling the doctor or going into the ED or the emergency room. Then we see that these patients have more hospital stays throughout the year because maybe self-care at home is not working. They don't know what to do and things go bad and they end up in the ER and then hospitalized. And then a big factor that we see is they're less likely to follow their treatment plans. So maybe they don't understand why they need to do certain things. Are they being communicated the benefits and the risks of their disease or diagnosis or treatment or medications? Often not. And then the last one is we see this group of people having a higher mortality rate. So more of these patients die each year in our country because of misunderstanding or low health literacy. Well, I love this cartoon because it really does show kind of the gamut of what we're hoping. So to achieve self-empowerment, I want you to be empowered as a patient, as a person, but you need to be well-informed. You need to have access to the right information. You need to be able to talk to the doctor and the medical staff, of course, and then be able to make the right decisions and feel understood, not feel like a number, feel like a person. And that is what people are, in such dire need for, to feel like their health matters. So what does strong health literacy look like? Well, here are 6 things that I think are key to someone that we say has strong health literacy. Number 1, they understand their diagnosis. I cannot explain to you how over the past 5 years, how many times I met with patients, sat with patients that told me they did not understand their diagnosis. They didn't understand why they were taking the medications they were prescribed, and they didn't understand their treatment plan. And that's not okay. We want you to understand that. And then understand those medications. I just mentioned those. Often people just take them. They may be taking them at the wrong times of day. They may feel bad from them and they're not sharing with their healthcare team or their provider, hey, is there another blood pressure medication? Is there something else I could take for my diabetes? So, those are the conversations they're not having. And then understanding your treatments, knowing why you do the things you're doing, understanding why you have chemotherapy or why you need to go to occupational therapy after a stroke, understanding why the treatment is so important and how it's going to benefit them in the long run is so vital to improved health with the patient. And then understanding your self-care. Often I talk with home hospice or home care, home health nurses that say that they really have, a huge challenge when it comes to care at home for their patients and helping their patients understand why it's so important to do different things. For instance, you're a heart failure patient. The reason they tell you to have a scale in your home is that you should weigh every day. And if your weight fluctuates more than 3 pounds, you could be in danger of going into congestive heart failure. And that would lead to an ED visit. And then that would lead to a hospitalization and more damage or trouble down the road. So knowing why you need that scale, knowing what's so important about it is key. And so I talk to home health nurses all the time that say, I have to go out and buy a scale for patients because they don't have one and they don't understand why they need it. Number 5, understand those risks and benefits. And I know I've said that probably 10 times already, but that's key for people. Often we don't want to hear the bad, but guess what? We need to know what our risks are and what the benefits are as well. And know when certain things happen, what to do, have a plan. And then the last one, and we've mentioned this as well, is understanding how to communicate with your healthcare team. And I can't tell you how often I've had to tell people, if you don't click with your doctor, if there is an issue, if you don't feel like you're being heard and you don't understand, there are other physicians out there. And so, while I think it's so important to have a physician, a general practitioner, I also think it's important for you and that person to have a connection, for them not only to be great at medicine, but for them to be really great at communicating with you. So there are a few key health literacy research findings that I really have pushed in the past 5 years, not only for our patients, but also for our healthcare teams, for our healthcare professionals. And this is just a few. Number 1, we can't blame the individual. It really may not be their fault that they're not an expert on the diagnosis that they've just been given. We also have to understand, no matter how educated, everyone is at risk for low health literacy. I work with patients that have PhDs. I work with nurses. I work with people that, for instance, let me talk to you about the nurses, because some people go, whoa, why would a nurse not know where to look? Well, recently I had a cardiac nurse contact me and say, my sister was just diagnosed with breast cancer. I've never been a nurse in oncology. I know basics, but can you help me find resources for her as the patient? And so, that is something that nurse had never had to deal with. So there shouldn't be any embarrassment with that. Until you're diagnosed with something, why would you have needed to be an expert about it? And in almost all cases, physicians and other healthcare professionals are trying, but they don't know unless you share with them that you don't understand. When they use terminology, medical terminology, or acronyms or things like that, stop them and ask them what that means. Write things down during an appointment. They will not mind. They will be very encouraged by you doing that. Just today at my husband's appointment, I whipped out my cell phone and I had a list of things I wanted to make sure we covered before we left, and we had covered all of them. So that's really important. Patients may believe they've understood directions, but then later are too embarrassed to ask. So they need an environment from their providers, from their medical team that gives them the confidence to ask questions. And then healthcare organizations and their systems, they play a significant role in health literacy. It is important what they do. And then one of the things too, there are additional challenges in understanding how to select and use insurance. That's a whole nother ball game. That is a challenge as a patient. And so those things all, really do affect low health literacy. So what did I do? So let me share my story. Pre-pandemic, this is what it was looking like for me within Orlando Health. I was offering in-person classes within the hospital facilities, and we had 10 hospitals within Orlando Health. And also I would do training in our family community centers that we sponsored, and then also our home health nurses that go into the home, as well as our physician practices. And we had close to 200 at the time. I offered to speak at department meetings within the hospital system to share my resources, to share with nurses and different medical team members, especially nurses, who they could refer their patients to, which was me. And then I connected with special groups within the hospital system interested in health literacy. So I began to do special projects and outreach with oncology, pediatrics, our NICU, and also our stroke unit, because they were interested. And so they wanted to help increase their low patient health literacy, and they looked to me for resources and also education. But then March 2020 rolled around and things changed. And I remember being in a meeting in March of 2020 where they said, hey, you're going home to work and you need to figure out how to make it work. We're closing the physical library. You can no longer be in the hospitals or the physician associate practices. We want you to limit your contact out in the community, but we want you to still do the same work. And so let me just be very transparent and say that was a scary day and that was a scary meeting, but I had to rethink and rework what I did. And what I had found was pre-pandemic, I had begun to do about 20 to 30 online webinars. I tried to do a couple a month, and they were pretty successful. People liked it because they didn't have to drive into downtown Orlando, go into a scary parking deck, and travel to the function. They could just do it on their phone, from their home, from their computer, any location with internet, they could log in and be a part of the education. So I had that under my belt. And so I had to realize quickly that our library had to become virtual. And I also had to make all of our health literacy education virtual. Well, I share this because Rotary International, the Rotary Clubs of Orlando, actually gave me a huge push and idea of how I could do this. So, often it's unexpected how things come about, but I like to give them credit. So I've been working with the Rotary Clubs in Central Florida and been a guest speaker at a lot of their meetings and just getting the word out about health literacy. And I had an appointment the week after we closed down with the downtown Orlando Rotary Club. We've got several Rotary clubs here in Orlando, but it was our downtown, our main original Rotary Club. And so I had to email them and say, hey, I can't be your guest speaker next week. I can't go back out in the community right now. And they emailed me back quickly and said, hey, do you know how to Zoom? We're going to do all of our meetings and we're going to do them Zoom. And we'd love for you to still be our guest speaker as a Zoom presenter. And I said, oh yeah, great. I love Zoom. I can do that. And then it was like the big light bulb went off over my head. And I thought, okay, this is how I'm going to do health literacy education. And this could really explode. I can go beyond the limits of Central Florida and spread my message. So I do love to give them credit for that because they gave me that idea. They asked me if I could do that. And that really led to everything that followed. So making connections during lockdown. So this was what I spent a lot of time doing, especially that first year in 2020. So I contacted all of my current connections and I let them know, hey, we're still online. We can still help you. We're just completely virtual. Your patients can still connect with us. We have email, we have phone, they can still get in touch with us. We can still help them. And we can also offer online virtual health education anytime you need it. So all of the areas I'd worked with before, they were really excited because most organizations, when they went virtual, they were in dire need for speakers who were comfortable and were willing to do it online. And they wanted to keep their organizations and their clubs going, which I totally understand. And then I had to find some new connections. So not only did my connections with the local Mended Hearts Cardiac Support Group go international, but also Rotary did. So I wasn't confined just to Rotary of where I could drive like within an hour. I was speaking with Rotary clubs all across the state of Florida. And then I also was able to reach out with different organizations, the Florida Library Association, the Tampa Bay Library Consortium, Tampa Hillsborough County Library, Sanford Library, and the Florida Library. I've got Florida Library Association twice, but they're awesome, so that's okay. But these were new connections that I said, hey, I can present information for you. I can be a guest speaker, but it did take time and effort. I had to send these emails, make these calls. It's work to make connections and form relationships, but you're going to see how beneficial it was. So I realized I was filling a need for a lot of people. A lot of people were just so desperate to find speakers who were willing to do Zoom that I got in pretty quickly, which was great because then once I did one presentation on a topic and got some really positive feedback, they were like, hey, can you do this again? Can you do this next month? And so it really not only helped them, but it really gave value to my work, and it showed Orlando Health that I could do this work from home and still reach so many people. So it was a win-win for both of us. So what were the topics that they were requesting? And these are still all top topics that I get requests from all the time. So number one, of course, was COVID-19, because people were terrified. We didn't want to go out of our homes. We were all scared of dying. You know, this was something that I had never seen in my lifetime. I don't think most people alive had. You know, a few people may have been 100 years old and seen a pandemic, but this was something new for not only the United States, but for the world. This was a worldwide pandemic. And all of a sudden we realized that our healthcare professionals didn't know what to do either. They were having to put this together day by day. And so there was so much fear. And so my role was really just coming in and saying, hey, these are some ways you can protect yourself. These are why the CDC's come out with these regulations. I did talk a lot with some groups about the benefits and the risks of vaccination. I want you to understand that I never give medical advice. I always lead people to resources so that they can make educated decisions. So I want someone to decide whether or not a vaccine's right for them, whether or not a medication is right for them, but I'm going to give them the tools and let them know where they can look to make those decisions. I did a lot of stress management and dealing with anxiety and how to be more mindful and how to focus on positivity instead of so much negativity, which we were just consumed with during this time. I also encourage people to have virtual appointments, telehealth. You know, there is ways to stay home and still see a doctor. I loved it. I took advantage of it. One time I had a sinus infection. Another time, you know, my husband had an eye infection. So while we were homebound, this was a great way to still see a medical professional. But a lot of people were nervous about it, had never done it, but we had sessions on how to do that. We also do things on talking with your doctor or your medical team. So that was really a sought after topic, becoming your own patient advocate. What does that look like? So we walk people through that. And then the other that you would see there on the end was sleep. And I still do sessions on the benefits of sleep and your health. And I can't tell you how often this is requested, but sleep is our body's fuel. It's not just what we put in for food and water, it's sleep. And so these were the topics that I was, you know, requested the most for. Okay, so I understand that we can only make a difference one person at a time. And I understand that that's all I can do. So whether or not I have a session that has today over 100 people, or I have a session where there are 5 people, it really doesn't matter, because if I can even reach one person and help them improve their health literacy, I know there's a chance to improve their health and their quality of life. So here's what we're up against. 9 out of 10 people lack the skills needed to manage their health and prevent disease. We know this. This is real. And so we want to, you know, increase the amount of people that can maneuver the healthcare system and can have improved health. So I love this because a lot of people don't know where to begin with a healthcare plan. What does that look like? You know, often we think it just means going to the doctor and taking meds. Well, There's so much more to that. There's what to eat, whether or not to exercise. What are health preventative resources? Do you know a lot of people have no clue that they should go for annual checkups, have blood work done each year? They should go for cancer prevention screenings. They should vaccinate, maybe or maybe not, dealing with their health. How to read instructions from the doctor, how to read prescription directions, and what options are for them. So there's so many decisions, and it really can be overwhelming to the average person. I know it's overwhelming to me, and I'm a medical research librarian. So my role became sharing free online health resources. That's what I wanted to do. I wanted to show people where the information they needed was available. So the number one place that I send people is Medline Plus, and the address here is medlineplus.gov. This is a medical search engine that's sponsored by the U.S. National Library of Medicine. There are no advertisements here. This is going to lead you to websites and information that is written with the patient in mind. And it's also going to be from credible sources, places you can trust, as well as written in a timely manner. I often would get patients come into my physical library setting before COVID and show me articles, and they were 5 and 6 years old. When it's cancer related or really anything in medicine, I want what happened last week or last month. I want the most up-to-date information, and you're going to find that on Medline Plus. So we have to be our own patient advocate. I can't stress this enough to those that I work with, to you today. You have to understand your health to the highest ability possible. I want you to understand, all of the different decisions you have to make, and I want you to feel confident in those decisions. I want you to be able to speak for yourself, talk about your health with confidence. Also, I want you to be ready to say, hey, what does that mean? I want you to be open to learn more. Don't be embarrassed by that. Be open to it. And here's what I hear sometimes. I heard this a lot with my oncology or my cancer patients that I work with. I appreciate your help, Jessica, but I've had cancer for 5 years. I know all there is to know about my cancer. Okay, but there's some new studies. There's some new treatments. There's some new things coming out. I want to be on the cutting edge of the medical conditions that affect me and my family. I want to know what happened last month, and is there some new and improved medicine? It improves on a daily basis, and I want our patients to understand that. And communicating with your healthcare team. It is so important for you to prepare. And I tell patients this, prepare for your visit. Here's the kind of the comparison I give them. Yes, I'm from Central Florida, the heart and soul of Theme Park USA. We have Disney, and we have Universal, and we have SeaWorld, and we have all kinds of things, and even smaller cool things here in Orlando. And here's the thing. If you were going to pay $100 to $125 for a ticket to go to a theme park, you would probably take some time to prepare. You may go online, see what they have, see where you'd like to eat, find out the rides you want to ride. You'd probably prepare, take some time, because that's a lot of money. Do we do that with healthcare visits? Often we walk in, we haven't prepared, we haven't thought about our questions, we haven't written anything down, and something sidetracks us. And we get to the car and go, oh, I didn't ask those really important questions I needed to. And so I work with patients to prepare for a visit, how to act and what to do during a visit, and how to follow up from a visit. So that's so important. You may not be getting your best health care, not because of your providers, but because of you. And so I want both parties to be able to communicate with one another so that the best outcomes happen. Understanding your medication. And I'll walk with patients through this on a daily basis. There are websites that you can go to find out the side effects, the benefits, also interactions. Often different doctors will give you different medications. And if your pharmacy may catch some of those bad interactions, but you also need to know that there are apps and there are things online that you can use that you can actually type in all your drugs and see if any of them cause bad reactions. You don't want that. You also want to make sure that you're taking the right amount and at the right time of day. So when it comes to printed medical information, I'm not saying that's bad. It's not. I like to have something written down. But let me just say that these are the areas that I think we really struggle as a healthcare system in America and that we really need to put more focus on. Number one is readability, what it looks like. And I push all the time, bullets, 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 sections, dividers in a page, simplified as much as possible. After the fifth bullet, guess what research shows us? People stop reading. So you want the most important up top. And let's say that you have 8 things you want your patient to know. Do 4 and 4. Break it up. We visually will actually read that and be more likely to understand. And then plain language. This does not mean dumbing down. It means wising up. It means writing it so that everyone can better understand it. And then the last thing is health literacy. And that's what we've talked about today. Where can patients get information? Who can they talk to? Do they know where to go online for the best information possible? And then make those awesome decisions. So last but not least, I want to show you some outcomes and some data over the past 2 years working, with outreach within the community. So if you take a look at our fiscal year 18-19, so this was pre-COVID, I did 23 online or virtual sessions, webinars, and we had 723 live participants. Now these numbers do not count how many people go back and look at recordings. At Orlando Health, we didn't have a way to keep up with those numbers. So these are our live participants. So then 19 and 2020, this ran from October of 19 to September of 2020. So during the first leg of the pandemic, we increased to 57 presentations, virtual, online, live presentations. And we had over 2,200 live participants. So our participants went up over 200%, which was amazing. And then this past fiscal year, we went up to 90 virtual presentations and over 3,200 live participants. So I can't tell you enough, how much of an impact it has made by creating these virtual platforms and bringing this education to people where they are. So these are our interaction totals that we had with our community health library. So as you can see, it grew every year. And this is what I call an interaction. That means any touch with a patient. So that could have been a student in an educational session. It could have been one of our team members or medical professionals. It could have been a patient or a family caregiver that I helped, or people within the community. But over 22,000 last year, and pre-COVID was just around 6,000. So a huge increase. And then our one-on-ones. What do I count a one-on-one? Well, I count that as working multiple sessions with a patient, helping them research their health. And so this past year we did that with 587 patients, which was phenomenal. So 587 people did extensive research on their health and they better understand their health today. And then our printed resources, if you take a look, before COVID, we gave out about 20,000 different materials in print. And then, of course, during the pandemic, that went down to 12. And last year was 15 because now we're directing people to online resources and encouraging them to print them out on their own if they'd like to do that. Now, with that said, we did offer a service that if someone didn't have a printer or access to that, we would print them off in the library and mail them through the U.S. Postal Service to their home. And so we did that often, especially with a lot of our elderly patients that asked for that service.
Jessica, sorry to interrupt. I just want to let you know there are several questions to get through. Okay. So if you probably about to wrap up, but just want to let you know to save
Yes,
some time.
thank you
There's
so
some good
much.
questions.
No, that's perfect. So fighting the spread, Health Librarians, Quill Pandemic Panic with webinars. This was a research piece that was put together in American Libraries, and I actually got to be a part of that because of the work that I've been doing online. And let me just say this too, you know, being or promoting your work is not a conceited thing. It leads to people reaching out to you for things such as this. So this got us a lot of recognition for our work, as well as being able to publish my first professional work, Virtual Health Literacy and Answer in a Time of Pandemic, through the Journal of Consumer Health on the Internet. So this also highlighted the work that we were able to do. And then I won't go through all this, but these were our virtual presentations and conferences that we've done in the past 2 or 3 years. And, you know, it really opened the door that I was able to speak at 2 international conferences as well. And then library professional collaborations, which is my heart. I love to connect with public library systems and help them increase health literacy and be a guest speaker. So I was able and still work with all 5 of these systems. All right, so here is my contact information and my email. So if you post this presentation, if you'd like to email me some specific questions or get in contact with me about being a guest presenter for a group or organization, that is the email that you can use. So now I'm handing question time over to you guys.
Okay. Thanks so much,
Sure.
Jessica. And yeah, we had some really good questions. So let me just tell everybody, thank you for your questions. And we might not get to all of them, but what we'll do is we'll try to get the answers from Jessica, and we will either send them to you or post them on the health literacy discussion list afterwards. So we'll try to get through as many as we can, but if we missed yours, not to worry, we'll get to it and get the answer to you. So one question was, you talked about fostering a supportive, open environment where you can ask questions about what's been discussed. And this is from Selena, who works in an STI HIV setting with very high stigma. So she's saying, how do you foster that environment? Because a lot of people say, oh yeah, we know we do that, but how do you really do it?
Yeah, I think it really just takes time. And unfortunately, in our medical situations right now, I know with the groups that I work with Orlando Health, they had a quota of how many patients they had to see a day. And so what I think that causes healthcare providers to do is rush and not be as friendly and as open and start conversations and get to know their patients. And so I think that's key, you know, just really offering an environment where you take a few minutes to get to know the person. You know, like, what have you been up to today? What do you do as your hobby? You know, just finding some little piece that you can connect with people. And I think that's something that's really missing. I think, you know, that's why there's not that comfort level for a lot of patients.
Great. Thank you so much. There's a couple questions about your audience and how you adapt these to different audience. So I'm going to combine some together. So how have your presentations been adapted for non-English speaking audiences? And then also, how do you help the senior population who are against virtual health or technology or not very used to it? How do you help them feel comfortable since they feel forgotten and isolated?
Yes. So both of those are challenges because I can only speak, I call it survival Spanish. And so I'm not fluent enough to speak in Spanish. So what we've done is there was a librarian on staff that was a fluent Spanish speaker. And so she would often be my interpreter when it came to those kinds of things. She also recorded some sessions in Spanish. And then the other thing that we would do is often when I would go within the community, different organizations had translators. So it just depended on the organization. But that is, you know, a challenge because I am native speaking English. And so when it comes to healthcare, unless someone could understand English, they were at a disadvantage with getting the resources that I had available. Now, what I would often do with patients like that is I would locate podcasts and videos and things written and prepared in their native language. So they might not be able to be in my session, but I could give them information in those languages. And then I think the other was if you don't have access to technology. And of course, that's something that, is a huge challenge no matter what organization you're in. One of the things that I did was I encouraged people to use the public library system if they'd like to go there and use their computers for our sessions. And partnering with the public libraries was a huge thing because then they could invite people into the library or their computer labs to be a part of the session. So, that's not a great solution for those problems, but that's what little were able to do.
Okay, great. Thank you. Also, there were some questions about your virtual outreach. So one is, so what other types of virtual outreach have you done outside of Zoom? And then also, there was another one of, do you present these at monthly and, how do you advertise? Who are they for? That kind of thing. So about your outreach.
Sure. So within the hospital system, I could put on events for the community. So I could invite them in or do them virtually. And so our marketing team would often create flyers, create things. And so I would actually post that on professional listservs. I would actually put it on LinkedIn. I would put it on a lot of the social platforms, promote it that way. And then if an organization asked me to speak, then their organization would usually do that as well. But for instance, I do a monthly session with Orange County Public Library on different topics that people request. And so with that, they not only promote it, but then I promote it on all of my platforms as well. So yeah, that's how we, promote that out and tell people. Also just, a lot of it is if providers will tell people about my services, that's been huge, but really just kind of, it's snowballed from really small things to large things. And then what was the second part of that question? The different platforms. Yes.
Yeah. So, besides Zoom, anything besides Zoom.
So Zoom, also MS Teams. I'm able when it's one-on-one to do FaceTime and Skype with patients as well. And then I'm trying to think, there's been another one that a couple groups has used, but yeah, really any online platform, I've been open to use.
Great, thank you. Here's a really quick one. You mentioned a website that patients can use to find the side effects of their medicines.
Yeah, so I would encourage, it's drug.com.
Drug.com.
Mm-hmm.
Okay, great, thank you.
And then you can also look up drugs and things on the medlineplus.gov as well.
Yeah. Great. Okay, so here's a good one. Do you have any tips to encourage administrators to prioritize these types of health initiatives at the library?
I think one of the things that's so key is doing your research before you present. So I think when it comes to going before administration, I know for me, I like to go ahead and show them some results from other places. So let's say that I wanted to do this in my company or library or academic setting. I would probably do some research and see what other companies are already doing this. There are healthcare systems. That's one of the things I did my 5 years at Orlando Health is I was constantly showing them what other healthcare organizations were doing and the money and the time they were putting into health literacy. And these were super successful healthcare systems. So I think that's key is go in with some proof, go in with some information. And even if you, contact me and say, hey, we've reached out to this health literacy advocate and speaker, and this is what she did in her system. And, that would even be something. But I think going in prepared, giving them some, real reasons why this is a need. I think that would be key.
Great. Thank you. Let's see. Do you, we'll take one or two more and then we'll close out. What do you do to help educate patients that know everything you tell them? They say, oh, I know, but still don't follow the prompting that you're giving them.
Well, I mean, it can be very frustrating. I encounter this with my own parents. They're both 75, and they often listen to their friends and they don't contact their daughter that's a medical research librarian. I don't understand why, but they don't. I think with them and with any patient that I see this happening with is just to keep a positive attitude with them. Don't become frustrated with them. Don't preach at them or tell them how bad what they're doing is. Just give them information that's positive. Like with my parents, I may send them an article or a video on the benefits of not having so much caffeine in their diet, or, it's got to be presented positively and that it's a help, that you care. And some people will never receive it. Some people will never change their ways, and that's okay too. So I've had to understand that sometimes we can't change people's habits and people, and all we can do is just be there for them, when they need that information. But I think presenting things in a positive way and in a non-judgmental way. Sometimes I'll even say, I'm having the hardest time not eating so much processed sugar, and kind of relating with them. If it's somebody you want to stop eating so much processed sugar, and that would be my parents. So I think that's key, is just keeping that attitude and just, still giving them good information, but not letting the frustration, come in between that relationship.
Yeah, no, that's very true. I'm going to squeeze one more in, and then
Sure.
Everyone else, we will try to send you the answers. But this is a good one. How do you measure impact? Aside from the number of presentations and resources, how do you know if people use the information that you provide in these trainings?
So the only true way to know is we did keep up with how many research consultations we had. So to me, if a patient reaches out and we have that, back and forth, and I'm giving them information and they're, really trying to apply that and use that with their physician and their healthcare team, I count that as a win. I count that as an improvement with their health literacy. We also would keep emails from not only patients, but healthcare providers that would reach out and say, hey, one of my patients went to your class and now they're going to do the therapy we've asked them to do for the past couple months, or, thank you for doing this class. And we would have patients, write us emails. We kept up with all of that because that was all, information we could use. But, sometimes there's not really a monetary or number that you can, use to prove that this is helping people. But here's my thing. It can't help. It can't hurt. So if somebody hears the information, even if they don't use it at that time, I have a lot of people that come back to me later and say, hey, just got this diagnosis. I thought you could help me with it. So I keep up with all of those kind of things. And that's what I use, just to validify the importance of health literacy.
Great. Thank you so much, Jessica. And with that, we will have to stop now. But thank you. It was really nice to see everybody so engaged and asking these great questions. And Jessica, this was an excellent presentation. It gave us a lot on both sides, the health literacy itself and how you present, and then also how you switch to virtual. So thank you so much, everyone. This will be on our site. The recording and the slides will be on our site. Please do the evaluation when you get it, and keep an eye on the Solutions Center for more good webinars like this and other networking. So thanks, Jessica, and thank you.
Thank you guys so much for having me, and thank you everybody for coming.